Well, hello and welcome to the 27th Degree with Chris and Nancy. So today we'll be discussing art therapy with Emily and Natale. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. As always, you can support the 27th Degree with Chris and Nancy by subscribing to us on YouTube or your favorite podcast platform and by following us on Facebook and Instagram. Also, please remember to leave a review. 5-star reviews are greatly appreciated. So we'll get right into this. So tell us a little bit about yourself and how you got into art therapy and your interest in it and all of that.
Well, thank you. So I've been studying art therapy for 20 years.
Wow.
I went right into it after high school, actually.
Okay.
Yeah. So I had a big interest in the arts as well as just kind of more service-oriented work and worked in a variety of different settings. So I did some intensive family outreach. I worked in the school systems, did a lot in aftercare, worked with psychological trauma, an intensive outpatient program. So a variety of things for years. And then I also kind of pivoted for a period of time and worked in research on project management and program management, specifically in the translational research side, kind of doing entrepreneurship and innovation. And at that time, I really kind of missed the clinical piece. Like I loved the research and it was so intellectually stimulating for me, but my heart was just, calling to go back to work with the people. But I really wanted to do it in a way that was aligned with what I thought would be most supportive for my community. So I, launched a private practice and have a healing arts studio now in Pawtucket, Rhode Island, where I offer individual, group, and family work for folks who are interested in using the expressive therapies for healing.
Nice.
That's wonderful.
So first of all, there's no way you look old enough to have done all that.
Yeah, that's a good point.
Like to say you've been in this for 20 years, I'm like, what?
Thank you. I will say it's one thing I do appreciate about my genes is we have good skin.
I guess.
Yeah.
I guess. So when you were doing your therapies, did you talk to me about what art therapy actually is and why you felt there was a need to bring that into what you were doing?
So art therapy is the use of arts and the creative process in a therapeutic space, right? So you're working with a therapist who has specialized training in the arts as well as counseling, and then there's this kind of overlap between the two. And so when folks come to see me, we're quite often actively creating or working with internal imagery. And sometimes that's through verbal processing. But part of my interest in that was because I found it helpful, right? It was just something that was important to me, especially when I look back on my earlier years, that was a big theme in terms of how I processed emotions or how I found safety and support and escape. And so it was very intuitive in a lot of ways. And part of the academic training was to kind of link the intellectual and the intuitive and to develop a bit more of a craft around it.
Now, how do most people get into art therapy if they're going into that field?
Yep.
Because it sounds like you could start off as, say, maybe an art major in college or maybe even a social worker or a psychologist with an interest in art. How does it all work out for most folks who end up in this field?
I think my impression at least is there's quite a few different pathways. And so for people who are already practicing as a social worker or a therapist, I believe there's now programs where you can do certifications and then you can apply that work, and through the American Art Therapy Association, you're going to get additional supervision and training around art therapy and working towards gaining those hours, and then you have the similar process as you would for mental health counseling or other types of degrees. You kind of have to go through this regulatory process. So you can do that after you have your master's degree in either social work or mental health counseling, or there is the track where you're specifically going into study art therapy, and a lot of those programs might be dual, right? So my program was dual, where it's almost you have 2 degrees with the art therapy and then the mental health counseling. So you're really kind of doing those 2 licensure pieces.
So if someone was interested in pursuing this, and they were entering college, they could go for a degree specifically for art therapy, or they could also go in more of a counseling direction and then do that as an add-on?
Yes,
Okay.
both. So I would say if someone is at a bachelor's level, you could take psychology courses and some art electives, and you'll eventually going to need your graduate degree. Right? You can work as a paraprofessional if you're doing
Right.
some psychology, but if you're at a graduate level, you'd be studying expressive art therapy.
Is this something that's like new that's come out recently, or has there always been art therapy?
Great question. It's a relatively new field, but
Okay.
it has roots back in the 70s, I
Oh,
want to
wow.
say, and probably further. But the concept of using art or any kind of art for healing that's not new. We've been doing that
Yeah.
as humans for
Right.
ages and
Right.
ages and ages, and we see it across cultures, we see it across the globe and across time. And so the profession part of it is more relatively new.
So, suppose someone hasn't exactly developed their artistic potential yet,
Like you.
but okay, like me.
Okay.
But they imagine themselves like, I would enjoy painting. I don't
Right.
know
Mm.
what the picture would look nothing like
Yeah.
a duck when I was done with it, but
Right.
like I just know that brushstroke movement, like I like it.
Yeah.
So does that matter? Like, can I just say, hey,
You mean, do you have to be a great artist to be able
well,
to
do you have to have
benefit
some
from
kind of
this?
talent, or can you just
Yeah.
go in and just kind of like fool around with the mediums and,
Yeah.
you know?
So you don't have to have quote unquote talent, I'd say, or skill, right? So that's the beautiful part. It's different than like learning art as a technical skill or a craft, that we're less focused on the aesthetic output. It's less focused on what the final product looks like and much more involved in the creative process itself. So anyone can make marks. Anyone can pick up a paintbrush.
See?
Okay. All right. Okay. I'll give you that.
So that has to do something to the brain, right? So if I have like a huge, big, difficult, hairy problem that I can't name Dr. Chunkus. I just can't. That I just
can't figure out.
I can't. Never. I can't figure out, or maybe I don't want to tackle, or maybe it's like a relationship that's really hurtful to me. I would imagine like that art, you have like a little bit of a safe zone, and like you can focus on something as you kind of build up and step towards what you want to talk about. Is that what you see, or like how does that work?
It works lots of different ways. I think that, what you're naming there, yes, it can work that way. There's this. So with imagery specifically, like we're tapping into different layers of brain processing. And so sometimes people will make imagery to help, or use art to kind of help express what's going on, and that can help kind of bring it out of them a bit. We can look at it differently, we can examine it differently, we can be in relation to it differently. And so that part can be helpful. And then there's other times that we can kind of use imagery to help bring information in too, because our bodies don't always know when we're imagining something and whether it's actually happening. So there is this kind of almost like back and forth process that can happen with art.
So when you talk about imagery and when we're talking about art, can you give us like some examples of art therapy? So this painting, I would imagine. Like what else do you do creatively?
So it can be a lot of different things. It can be really kinesthetic. It can be really sensories. It can be cognitive. It can be symbolic. It could be affective or perceptual. So in terms of mediums, even if you just walked into my studio, I have chalk pastels, oil pastels. We have a couple different types of painting. So I use acrylics and watercolor. And then I have a bunch of different recycled materials too.
Nice.
We'll work with natural objects. We'll work with collage, clay. I use a lot with clay. So there's so many different art mediums that can kind of lend itself, and it also has a bit of a personal preference, right? So what works for one person isn't necessarily like the recipe for everybody else. Part of that is figuring out what your system wants and needs, what you're trying to work through, and kind of using that in the process.
At least a couple of times a week in my primary care practice, I'll
Mhm.
have someone who comes in who I think would benefit from counseling.
Mhm.
And they say, I just don't want to talk to someone. I don't, and it's mostly men, by the way.
Mhm.
I think women are better about that.
Mhm.
If they need to see a counselor, they're more willing to do it. Men,
Mhm.
a lot of times, just don't want to do it.
Mhm.
They don't want to open up. They don't want to talk to another human being about their issues. They
Yeah.
don't even understand what their issues are half the time, right?
Yep.
So does this help with that? I would think this would help with those types of folks who maybe have a difficult time opening up to
Mhm.
another, individual in a counseling type of
Yeah.
environment. This could bring out some of those feelings or thoughts that they maybe don't want to share with someone.
Definitely. And honestly, a lot of my folks, I think come because of that, right? Or it's hard to even articulate and find the words for it.
Right.
And if I'm working with kids, like it just naturally is a little bit more of their language. And then it's not so much about me, right? It's not so much about opening up to me. It's like opening up for themselves and being in relation to themselves differently. That can be really powerful.
Oh, I didn't look at it that way. That's so right.
Mhm.
Right.
Mm.
Definitely. What about, do you use the product of the session to kind of evaluate if they're progressing? Like, suppose they start out, suppose my picture, the first session's all black, angry, mad strokes. And then I start using like a little bit of, is that legit for a therapist to kind of see what they're working with and how they're using those mediums?
I love that question. I don't get that a lot. For me, yes, actually. So you can kind of see sometimes with folks, like they might come in and have a particular way of working. And then over time, when there's like shifts or they start wanting to expand the way that they're creating or even trying other mediums and what that can elicit, that feels like progress to me because there's a little bit more flexibility in how we're actually engaging with the medium.
I would think too, like it's not as intimidating sitting with a therapist, sometimes if you can have like a second focus, like you can just, make your little clay bowl and
Mhm.
kind of like focus on getting all the creases out while your brain kind of processes. It gives you time to process stuff, right?
Yes.
My
Definitely.
gosh.
So just like with that restless energy that might happen,
Yes.
that you can channel that. And sometimes you don't have to talk, right? Like it's not always about talking. Like that's an important piece of it. But sometimes actually just even engaging in the creative process itself is what can be really healing and helpful for people. And a lot of times I'll hear like, Emily, we can talk about the feelings, but it's like they're over here and I'm over here. But when I make art about it, I can experience it. And they can experience it in a way that it like doesn't flood their system maybe so much, or they're not so overwhelmed with the emotional state. There's a bit more like a space or objectivity while they're experiencing it.
It's safe. It feels safe. It
Yeah.
must feel safe.
Yeah.
Now, when you're having a session, do you jump in there too and make like pictures and sit there with them so you're not like staring at what they're building?
Sometimes yes and sometimes no. So there's a dance that I do because if I'm going to engage in my own creative process in parallel to someone else, I need to be really cognizant and aware that I'm actually holding space for them.
Yes.
It's not really about me and my process.
Right.
So I might be making something that just helps to kind of be in play with them. Or sometimes I might make something that is in response to what I'm feeling or what I'm getting from the space actually and our
That's
relationship. And personally, I actually find that really helpful because it gives me more information of what's happening for me to digest and use. But then there's other times that it's not actually clinically appropriate for me to do that. And I'm holding space and kind of being with them as they're creating, which some folks might feel uncomfortable at first, and then eventually I think they just kind of get into a rhythm or they kind of get into their zone that, yes, there's somebody here with you, but I'm not like watching you. And
Now, is
you know
there,
what I'm
that's
doing.
are
wrong.
you
You
there
shouldn't use that color.
alone with one client, or is there a group of clients that you're working with?
So I primarily work individually.
Okay, because I would think that would be hard to kind of, if you're in a big group, right? You can't really counsel them or have some discussion with them.
Unless maybe it's like a
individually.
family though, right? Like I would imagine if there's like tensions in a family, like that might be not like a group of strangers,
No,
like
I see
maybe
what you're
you're
saying.
saying,
Yeah,
but
that
like
might work.
a group of family, like where
Both
there's
are
like
true.
tense relationships, you can
Mhm.
kind of like focus, right? How does that work?
So I've used I've used expressive therapies and art therapy specifically with families lots of times, and that can be really helpful of almost like leveling the playing field a little bit. Like parents tend to be at a different place
Of
than the
course.
kids, so that can be helpful. But you can also use art therapy with groups, and actually a lot of people find that also
Oh,
really powerful too, because again, like they can kind of work on their piece, see from others, and be in relation to others.
Yeah, well, it makes sense. I mean, we have group therapy sessions, right? So it's kind of, why wouldn't you, now that I think about it, why couldn't you do group art therapy too?
Yeah,
So there'd be support from the other people in the group
exactly.
to the individual. That's interesting.
that's super interesting. But now, if someone's like, say they're listening to this podcast and they're like, oh, she's really cool. Like, I want to go see her, but I'm not going to paint or anything.
Mhm.
Can they just see you as like and not use any of this art therapy?
Totally.
You're like,
Yeah.
it's whatever they want to do.
Exactly.
Oh, that's nice.
Yeah. So, I mean, I have some people who lend more towards verbal, and that's okay. I will say, like, for me as a practitioner, I do still use a lot of internal imagery. So we might actually talk about images and not actually create them and externalize them. Or we might be using more like sensory data that they experience from their emotions. And we're kind of tuning into the different levels or layers of their kind of being within the verbal processing, if that makes sense.
So
It makes sense,
it
but
makes
I
perfect sense.
don't.
Yeah.
Well, you're more intellectual than I am.
Well, I don't know about
guess.
that. Come on, Nancy.
Can you give me an example of like when you say imagery? Like, what is it like a? What I'm thinking in my head is like a guided meditation where someone's like, picture this or picture that. Is that? Can you just kind of give an example of
Sure.
what you do?
So when I'm working with somebody, we might be touching on something that they're verbally processing, which is like sticky or hard. And I might ask them what that feels like, right? Like, what does that feel like? Well, that I'm anxious.
Okay.
Well, what is your anxiousness like? Is there an image for that? Is there a color for that? How do you experience anxiety? Because Nancy, your experience of anxiety is going to be very different than mine.
It's true.
Right.
And
right.
so bringing it a little bit more granular or understanding their unique imagery or metaphor around it can be just kind of a place where we can play with a bit.
I love that.
It's an interesting point because a lot of, I noticed that a lot of patients experience anxiety, for example. We use that, since you brought that up, in a very different way.
Mm-hmm.
Some people worry and they feel nervous. Some people have anger as
Yes.
their experience of anxiety,
Mm-hmm.
which is interesting too.
Mm-hmm.
So it can externalize in different ways with different patients.
Mm-hmm.
So very
Yeah.
interesting.
Yeah, you know what? It is interesting. And I had like a mini believe it or not, I had a mini meltdown yesterday over
Sorry.
something. It was my pool filter,
Oh,
right? Like
geez, yeah.
just like this little thing that just something went wrong with
Yeah.
it. And I was like at a 10. And my husband's like, I love him. He's very supportive, but he's like, oh my God, really? You're going to get all anxious over this? And it's like what triggers me to be like a 10 out of 10 on the anxiety scale is different from what triggers you.
Right.
So
true.
then feeding back into what you said, like people, and you said people are going to experience anxiety so much differently. And I love that you like dive into that and just kind of bring up that imagery. I think that's so wild.
It's interesting.
Yeah.
As I'm sitting here, I'm thinking about this because as I had mentioned before, I was an art minor in college. So I've always had an interest in art.
Yeah.
But your experience when you go to a museum must be so different than mine.
Oh
Because
my God, that's
you
a
must
great
go
question.
and look at these pieces and say, oh my God, what was going on psychologically with that person? Like if you look at like the Scream by Munch,
Mhm.
I mean, that's a really powerful piece. Or just, some Van Gogh pieces or whatever. You must be able to really get a better sense of what was going on psychologically just from your training, I'm thinking.
So I appreciate this question.
Yeah.
So there feels like there's two answers there.
Okay.
The first part, I feel like you might be teasing a bit that there's, and you can check me if I'm off, but there's a sense sometimes that like, oh, if you do art therapy, then you must be able to look at an image and tell me what what's going on with this person.
Well, that's what I'm wondering.
Yeah. No,
No?
I don't have that superpower.
You don't?
No, I don't. It may be kind of interesting, but I will say, after seeing and working with lots of images and people, I feel like I have a sense sometimes. But then again, like, I'm not the artist.
Right.
I don't know what their experience is. I don't know what their cultural backgrounds are, their unique experiences that make them who they are, because their expression is so unique. It's like a fingerprint. I can't decipher that. And when I go into a museum and I look at images, I'm really actually tuning into my own experience. And I actually encourage people to do this too.
That's a good point, because when you look at a piece of art, you're right. You're kind of, it means something to you as an individual. You're not really tapping into necessarily what the artist did. But sometimes I like to look at art in the kind of the historical context.
Yeah.
So if you look at like pre-World War II art, it's very interesting. A lot of it was very dark, and there was a reason it was dark. I'm talking mostly about European, German art around that time. Look at the art like Munch and Kate Kowitz and things like that. Some really strong images. But you think about what was going on around World War II. I'm not sure this was all pre-World War II. Actually, my art history was a long time ago. But it's the history kind of. If you know the history, you kind of get a sense of what was going on, right? With a lot of those images back then. It's interesting, but you're right. It's all individual, right? When you look at a piece of art, we all look at it differently and get a different individual sense of what it means.
But we do get benefit from just looking at other people's art and tapping into that. Like there is. It's interesting. Like we see actually that the art that's in the walls for patients, right? And in hospitals, that makes a difference.
Sure.
Right? Like it's so powerful for us to witness other people's art.
Right. Yeah. No, definitely.
Yeah.
So true.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
Now, when you're working with people that are doing some form of expression, do you feel like a therapy session that includes that? It seems to me like that brings a different dimension. And like when you're with your clientele, I mean, to me, it would almost, this is going to sound so naive, I guess, like fast track them a little bit to just getting closer to their goals, like quicker if they have different ways of doing things. It's
So
like
you're wondering if it accelerates the process, the healing, the therapeutic process.
Right. I don't know if there's any literature on that, if there's any statistics on that, but it would just seem like if you have a multitude of ways to heal, that someone has a better chance of tapping into that to resonate with them to heal faster.
I'm not sure about the literature on that either, but I love the concept. And I can see that too. And I think a lot of times I do hear from folks, like another piece of why they might want to tap into the expressive therapies is to have that outlet or is to have another way that they can go and do that outside of the therapy hour, right?
Yeah, that's true.
Is there a group that you've noticed that benefits from this like a little bit more? Like do kids like take to this a little bit more and benefit from it a little bit more? Or is it just kind of like all across the board?
All across the board. All across the board would be my answer there. It shifts and changes maybe depending upon who you're working with, but for the most part, I think, art's for everybody.
Now, is this covered by insurance, like the type of therapy sessions that you do?
So art, it's a complicated answer. So art therapy purely isn't covered by insurance. A lot of times when people are working with an art therapist, they'd be reimbursed through the mental health counseling aspect of it.
Okay.
So some folks, some counselors that are art therapists will work with insurance. I personally don't anymore.
Okay.
Yeah.
All right. So then,
You're
can you
probably
tell
wise
us,
not to.
right? Can you tell us what a typical session, like when you first meet someone, like how do you introduce them to using the therapy and all the art therapy, and like what does that conversation look like?
It depends on the person. So some people want to jump right in, and other people might feel more hesitant. And in the beginning, it might just be exploring, like, make whatever you want.
Yeah.
What do you want to play with here? And depending a bit on what they're there for and what they're working on might help guide us a little bit in terms of how we would start. So there might be some folks that we might be doing more sensory motor kind of art therapy versus more conceptual kind of top-down art therapy. And those kind of entryways in, or what I offer to somebody, really just depends on the individual.
Is music included in this, or
That was my next
basic-
question. How did you guess that?
I
You're
just,
amazing.
So music, so there, if we back up a little bit, so there's art therapy, which kind of falls under the expressive arts therapies.
Okay.
So you have art therapy, music therapy, drama therapy, dance
Oh,
therapy.
Thank you.
I'd even throw in like sand tray, play therapy, writing therapy, right? So there's all of these
Okay.
different expressive arts that people can use
Oh.
for therapy.
Okay.
And then there's expressive arts therapy, which is kind of the use of all of them or multiple of them, and the transference between different modalities. So you might be making a painting and then writing a poem, and maybe there's music that comes from that, right? So you're transferring from one modality to
Yeah.
another.
Nice.
Interesting. Yeah.
Mhm.
Do most
Yeah.
of your patients stick with like one modality, or can they, like, do you see them kind of going from like clay to paint to?
They explore, and it's interesting too, right? Because I have some people that come in for art therapy, that's what they want, and then something shifts or changes, and we find that we actually do a lot of movement together, right? Or we're doing a lot more like breathing and dance. So it really can look different depending on the person, but yeah, there's movement all over the place.
I think that's great that you're not boxed into something.
Mhm.
Like,
Yeah.
because you're going to be in different moods when you go to your sessions. And, today's not a paint day for me.
Yes.
That's great.
Yeah.
I didn't.
I would think the music therapy would be a little bit harder for many people to access, because you'd have to have kind of a little bit of background in music, right? To be able to play an instrument or whatnot.
Well, I guess it depends, So first of all, I'm not a music therapist.
Right. I'm just thinking
But,
about this,
yeah.
as we go through the conversation.
Yeah. No, I mean, it's a great question. My impression is, right, like sometimes it can be listening to music.
I see.
Right.
Okay. That makes more
Writing
sense.
music.
Oh.
I got you.
I have drums in my office too. And so, I'm not a drummer, but like sometimes for people, there can be something really safety producing about creating rhythm or communicating with drums back and forth. And these might be people you'd never expect, right?
Yeah.
You'd never have an impression like, oh, let's throw some drums into the mix and see how it goes. And then they'll call me, Emily, I need to get back to those drums. Like there's something that just unlocks for them when they find whatever it is that they're looking for.
Why is that, though? Why is it we sometimes can't verbalize things, but we can access those feelings through art or music?
Yeah.
I wonder why that is.
I mean, my impression is that there's different layers of how we process information, and that there's some parts of the brain that don't necessarily speak English, right?
Okay.
They don't
makes
speak
sense.
Spanish or English, but they would speak more color and imagery. And then there's other systems that speak more sensory or motor. And so when I'm working with people and we're doing gesture or we're working with movement, I'm actually, how I see it is I'm working with a different part of their brain, different
Okay.
part of their being than when maybe we're, cognitively processing something and problem solving and strategy, right? Because sometimes we can't do that when emotions are really high. So we
Right.
might be working in a different dimension. So I really just see it as like just different layers of brain processing and working with different parts of people.
Interesting.
Emily, some of my patients that I work with are developmentally delayed or might have a severe case of autism or something.
That's a great point.
Is this beneficial for that population?
Yes. So the piece around the beauty of art, right, is that it's really versatile. And so, we don't necessarily have to verbally process it all.
Right.
And so there's different things that we can do. I might work differently with that individual. When I was much younger and working with some folks who had who were on the autism spectrum, we were actually just working a lot more sensory oriented.
Right.
We might be working more on dexterity or moving our bodies in different ways and how different rhythms feel for us, right? And so again, like I that's what I love about it in a lot of ways is it can just reach so many people in so many different lifespan, like different parts of their life. Like it really can tap in lots of different ways.
Can you share with us a story of a patient that just kind of warmed your heart?
Oh, I have to say I have a few, but I will speak to one in particular who I worked with for probably about 2.5 years. So when this individual came to work with me, they had said, like, my behavior changed and I don't know why. And they had a really, really hard time articulating what they were experiencing. And they had a really hard time just even identifying or naming their emotion. And so this had a lot of impact on them, right? Like their body would like start shaking, for example, and they didn't understand what was happening. And so they would get really, well, I'm going to use this word, like overwhelmed, and it would impact their relationships. They stopped working. There was lots of conflict with family. So there's this big ripple effect that was happening in their life. And so when they come to see me and they say, like, I don't know what's happening, but sometimes I just feel crazy and my body starts shaking. Well, that can mean a lot of different things, right? And this is a generally physically healthy individual. Like there's no medical concerns, which is definitely something that you're also thinking about. So we use the arts, right? Like one, just to understand like what's going on for you. And then over time to really help to articulate and express what they were experiencing. So somebody might say, I think actually, even Chris, going back to what you mentioned earlier, like, well, why is it important to talk about your feelings? That's such therapist woo-woo, right? But it makes a big difference in that we're seeing that if you can articulate and name your internal experience, you do better, you feel better. And it improves your relationships. And it made a huge difference for this person. And so, we touched on a lot of different things, like big existential questions, like what does it mean to be a human? What do I want in this life? What is my purpose here? What values do I have? Down to what kind of job do I want to have? Or I'm having a fight with this person, or I can't forgive myself of some harm that I caused. And I'm just so angry with myself, right? And so we really sat with some hard things. And sometimes we'd make art, and sometimes they would actually go and paint something and just bring it in of some image that came to them, and that we would be processing this a bit. So this is when we're looking at the product a bit more and kind of exploring what that meant to them. And, I also incorporate a lot of somatic work and breathing and different things like that. But towards the end of our time together, part of what they transformed, but part of what I was also seeing was these other things were like kind of clearing up or shifting in their life. And we might have touched it, but like it wasn't like a target for me. So he would say like, I'm not smoking and cigarettes anymore. And I'm actually, I've been making myself breakfast. I'm able to care for myself more.
Oh my God.
I made some new friends, right? I got a job, right? So we might be touching on these things, but they're, like I said, they're not targets. And part of what I see there is that since art is such a whole-brained activity, and we're such association machines, that I don't necessarily have to target all of these things. You kind of can work deeply, and it just kind of pulls out and helps things.
It's almost like a byproduct of like fixing the core.
Yeah, I just like delighted in that. Like, what? That's amazing.
And I bet like some of these things are said so casually, and you're sitting there like, oh my God.
Yeah. Yes, definitely. Like, whoa, that's cool. I didn't know that we were working on that, but yeah, that's great. But, they had said to me at the end that they felt more present and they could process their emotions more in real time versus like carrying it with them. and that they felt like they had a map and a compass now. And for me, that was actually the most heartwarming, right? Like that you could feel like just, yeah, go live that life of yours. Go be who you want to be.
That's a great story.
Yeah.
That is a good story.
Emily, do you find that a lot of people run from their emotions or try to avoid it? And can you talk a little bit just about maybe why we shouldn't do that and like maybe embrace the pain a little bit?
Well, it's so normal and natural for us to say, ouch, that hurts. I don't want to go there, right? Like it's actually counterintuitive, which is why I think we just naturally do it. But sometimes, if we're not actually acknowledging or processing these emotions, they have a way of showing up again. And being association machines that we are, our brains are actually always predicting what's coming in the future.
Right.
And so, if we're not kind of helping to shift and lay the ground a little differently, we might be predicting things happening in the future or creating or having a perception of reality that might not necessarily align with where we're actually at. So that's one piece of it. And another piece is just to kind of help, like, I almost think of it like digestion. Like we just want to like process it out so we don't have to like carry around all the gunk with us so much. We can be lighter. We can feel better. We can have connections with other individuals.
Yeah, that's great.
Yeah.
Now, what happens if someone has a in-depth mental health background and they're on multiple medications and you take them into session and you're working with that? What with the medication adjustments that need to be made, how do you factor that in with your therapy?
So regardless of the individual, like medication, that's something that we're always kind of touching on and looking at. But if someone comes in and they have a lot of medications, my hope would be, who's your prescriber? What's your relationship with them like? I actually process people's relationships with their medical providers all of the time. Oh my goodness.
It's important.
Yes, it is important. And so understanding what their relationship with their providers like, how they feel about their medications, and kind of monitoring some of those changes. We're just kind of checking in on it.
Right.
And I will name too, like there's some folks that I might be an adjunctive service. So they might have a quote unquote primary therapist and have an additional art therapist or expressive therapist to help complement or round out some of the stuff that they're working on.
For a therapist that may be listening to this and have an interest in art therapy, like suppose they're very interested in working with you or starting like an internship, like what kind of programs are out there for that? And how do you bring someone in and do training with them?
So I'm trying to figure that out, honestly. It's tricky. I mean, at least where I'm at, there's some.
Can you name your business again, by the way?
Yes, I don't even know if I named it before, but Create Art and Wellness.
Nice.
Yeah.
And where are you located?
Pawtucket.
Pawtucket, okay.
Pawtucket, Rhode Island.
And if they want to reach you, the number?
Oh, 401-240-4540. Ooh, those numbers were hard to recall right there.
You're never dialing them yourself.
That's understandable.
Yeah.
But then if you're bringing in a therapist,
So it kind of depends on where they're at in their professional development. If they're licensed, it's a different conversation.
Sure.
If they are a master's level clinician, that's also a different conversation than an internship. So there's lots of regulations, in Massachusetts, there's a lot of regulations on what would quote unquote count for your hours towards licensure. Yeah. And so private practice generally is not a place where people go to get their hours, right? You're generally working in nonprofits or more community-based organizations. Yeah. And so I think that there's some shifts in licensure, in the licensure landscape around that, at least in Massachusetts. But part of what I'm seeing in Rhode Island is like a tremendous, it feels like tremendous to me, this like outpouring of people wanting internships or jobs or really wanting to kind of like stand up as an expressive therapist and do more outpatient community-based work. And I'm trying to figure out how to help them do that.
Of course.
I wish I would have had that. I think that's part of why, instead of kind of maybe molding into these other roles that don't necessarily quite fit an
Why
expressive
do you think
therapist.
there's more of that now? People interested? Do you think it's because there's so much more mental health issues out there? Because certainly we notice a lot of that in primary care. So I'm wondering if that's part of it and why there's more interest.
You know, it seems to me that it feels like art therapy has gone a bit more mainstream.
Okay.
I see more products around art therapy. I see more maybe just general interest about it. And so I'm not as sure. It could be a little bit of like the culture in general is changing around mental health. But it does feel like there's a lot more interest in just what is art therapy and how do I do that? How do I move in that direction?
Do you do telehealth visits?
I do.
Oh, you're awesome.
That must be interesting to do as an art therapist.
Yeah. I wouldn't have signed up for it, but COVID has expanded my skill set, shall we say. And, I've figured out how to work with it. It is different, right?
Yeah.
So if people want to do art therapy and we're meeting virtually, like they have to have their supplies ready versus like stepping into my space where, you can play with this or that.
Yeah.
But yeah, it's transferable.
Do you have diagnoses that, you don't deal with? Like, do you deal with schizophrenia, for example, bipolar? I know you deal with depression and anxiety and those types of conditions. But how about, more of the schizophrenic population and that? Do you deal with that?
So that's not my specialty.
No.
Yeah, there are art therapists who do.
Okay.
Right, but it's not my specialty. I tend to work with folks. Well, I guess I'd say to have 3 buckets, really. So there is a lot around psychological trauma.
Okay.
And with the intersection of chronic pain and spirituality is a piece that I play with. And then I work with a lot of individuals who are, I would say, like really high functioning. Like if you were to look at them, they have like this strong job and they got this going on and that going on. But inside is like, oh my gosh, there's a lot of mood or low esteem and some stuff going on there. And then I work with children and families too.
Okay.
Nice. Wait time. Do you have, like, sometimes it takes months to get in with a therapist. What's your wait time averaging?
It depends. Honestly, it depends on the season a little bit too. Summer is a little easier to get in, and it kind of depends on what someone's looking for. So daytime tends to be a bit easier. So right now I'm probably looking at maybe 3 to 6 months. But I did bring on an associate who's a music therapist, actually.
Oh.
And she's got a little bit of availability.
That's
Nice.
awesome.
Yeah.
Very good.
Okay.
Any more questions?
I got all the information. That was wonderful to hear.
I think so,
I'm
too. This was
satisfied
great.
with that.
I've really learned a lot.
Cool. Thank you.
It's not a field I knew a lot about, I must be honest.
No, I was like, I couldn't wait. When you said yes that you'd come on the show, I was like, oh man.
But I'm sure that this is
This is a
something
win.
our viewers will really enjoy.
Yeah, I think so.
Oh,
Definitely.
I think a lot will benefit from this. And
Yeah, I've had a couple of my friends ask me when you were coming on. They
Oh,
were
how
like,
sweet.
they've marked
Yeah.
it in their calendar.
Oh, how sweet. Well, I really appreciate that. And I appreciate the opportunity, too. I'm quite often on the other side, right, where I'm like listening and
Right.
supporting more. So
Right.
it's nice
Yeah.
to be able to kind of share a bit
No,
about
this was
what
great. It was very,
Nice.
very informative, very interesting. So I want to thank you, of course, for coming on our show. It was really, really interesting. And the one message.
That
yes,
was the
last
last question.
Oh, we have
Yeah.
one more question for
I
you.
do. Okay.
What's the one message you'd like to leave our audience with?
Everyone is creative. Everybody. And if you're not a visual artist or even visually inclined, maybe it's music, maybe it's cooking, maybe it's movement, like it doesn't matter. Just find what your creative method is and really lean into it because it's an incredible source of strength, support, healing, and it will carry you very far. So I really encourage people just to lean into their own creativity.
I love that.
That's a great message.
Yeah.
And you must see people who never thought they were creative and then come to you and realize that they have this, this way of expressing themselves that they didn't know they had prior. Huh?
Yeah.
And that's great. That must be wonderful.
I think so.
That's what separates us from the computers. That's why AI will not take the place of humanity. So at least we hope not.
We hope not.
Yeah. Well, thank you everyone for listening to our show. If you'd like to become a sponsor, please contact us at 774 319-4230. It's really hard to read that. I'm getting more difficult reading that.
We should tell Tyler to increase the font to
Yeah,
like 35
definitely.
because,
My eyes are starting to fail me, I think. Special thanks to Ron Gamache for our intro music, the PC Institute for producing the show, and of course, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Thanks again so much for being here with us.
Thank you.